Medicare Advantage plans, are they free? Maybe you can find a Medicare Advantage plan with a very low, sometimes even a zero premium. Once you use the Medicare Advantage plan, it's not free. So it's a very common misconception that if you get a Medicare Advantage plan, it's not ever going to cost you anything. They make them sound very good by adding in some things that you might not get otherwise, like a discount or a free membership to a health club, maybe a little bit of dental, a little bit of vision. But it's important to understand that on a Medicare Advantage plan, there are lots of rules, starting with you cannot necessarily go to any medical provider that you want, because Medicare Advantage plans do have network restrictions. So before you get a Medicare Advantage plan, you need to make sure that all of your doctors accept the plan, make sure that your medications are covered, and understand that every time you use the plan, whether it be go to the doctor, if you need blood work, testing, treatment, therapy, emergency room, ambulance, outpatient, hospital stay, home health care, durable medical equipment, every time anything happens, you are going to have a cost-sharing payment involved. There is, of course, something called annual maximum out-of-pocket, which means that each calendar year on a Medicare Advantage plan, as you get a bill and you pay it, that number adds up, and eventually it gets to a certain number, and then you can stop paying any more on that plan for that year. But many times the annual maximum out-of-pocket is a very large number, sometimes $4,000, $5,000, maybe even $6,000. So we do agree that there are some occasions where enrolling in a Medicare Advantage plan can be the best option for the individuals that we're working with. But it's also very important to understand that even though the monthly premium might be very low or even zero, if you do have some serious health challenges, being on a Medicare Advantage plan can end up being very expensive. So if you would like for us to look at the Medicare Advantage plans that are available in your area and give you some idea what they look like, what their costs are, and compare that to what it would cost you to get a Medicare supplement plan, we would be very happy to do so, and those services are always free.